5, 4, 3, 2, 1. Let's go. Good morning, Misfits. Alrighty, we have a guest show today. You know, we throw those in there whenever we can. We're going to be bringing on Dr. Ryan Elfenbein. I think I want Elfenbein. Elfenbein. He's going to tell me. Elfenbein. I think that's right. I think that's the right way to say it. I am horrible with names. We do the end of the show, the shout outs. And I get some great ones when I try to read your usernames. I mess them up all the time. But let's just jump right in here, and I'm gonna just go off of the description for this. I didn't hear about this story, but Dr. Ron was known for being outspoken against the I guess you could say science, and he was, I would argue, just based on my limited research, a target and weaponized. The Biden DOJ was weaponized against him. So I don't want to, speak for him. I think we should just bring him on. So here we go. Dr. Ron, first of all, how do I do with the name?
It's Elfenbein, but
Elfenbein.
You're close.
All right.
Yeah. Actually, I think that was one of the ones that you said.
I said all of them. My last name is Bonfilio. So when I get I'm sure you get this too, but when you get the cold calls, right, where people are, yes, is Mr. Bonfilio there? I'm like, you added so many vowels. You didn't need to do that. But yeah. Great to meet you. I'm on X right now, just looking. Oh, let me pull this up, and I'm seeing just a couple of posts here. But Cynthia Hughes, real Cynthia Hughes, posts the Biden DOJ charged a well-respected Maryland physician, Dr. Ron Elfenbein, similarly because he dared to speak out against Biden DOJ. He won his case on appeal before the Democratic appeals judge. Now, the very rogue, overzealous prosecutors ignored the ruling and re-prosecuted him anyway. I don't know if people are fully aware of the issue with the Justice Department. I would say one of the larger issues is rogue judges, is activist judges. So could you give a little breakdown? First of all, introduce yourself. If I got anything wrong, if they got anything wrong, go ahead and tell your story and let our audience know what you're doing here and what we can do to help.
Yes, thank you so much. It's a pleasure to be here. Zach, nice to meet you. I've been a fan for a while, and thanks to everybody for being here. So I'm an emergency room doctor. I live in Maryland. That post wasn't entirely correct. So in 2000, really briefly, I was very active during COVID. I had an urgent care center that I ran. Didn't work there personally, but ran it as the medical director. And we became like one of the largest testing sites in the state of Maryland. We went from one site to 8 very quickly. And I was a very early adapter of the monoclonal antibodies, which essentially were the cure for COVID. Mm-hmm. And I was on national and international news probably at least 2 or 3 times a week. I was on CBS, Breitbart, NBC, ABC, Fox News, Newsmax, Sky News. I was even on some Australian news network and some Saudi Arabian news network. But anyway, I was all over the place talking about how wonderful these things were and questioning the vaccine narrative, saying that, not everybody needs to be vaccinated. That's not the way you do things in medicine. And that was nonsensical. Mm-hmm. The Biden administration came out and decided that they were going to start imparting DEI to medicine with regards to the monoclonal antibodies. We had 2 infusion centers. We were the largest infusers in the state of Maryland for the monoclonal antibodies. We're bigger than Johns Hopkins, bigger than University of Maryland. And I think the only private company that was doing it. And so, we would get the lion's share of the state's allocation on a weekly basis to provide these infusions. And all of a sudden, the Biden administration said, well, we're going to change the way we're allocating these things. We're not going to do it based on need anymore. Now we're going to start doing it based on equity. And I went and I said, that doesn't make any sense. There's no reason to do that. You don't do that with anything else in medicine. Why would we do that with this life-saving drug? So then they came out in 2021, in December of 2021, and they said, well, it was an Omicron surge, and they said once the prevalence of Omicron reaches 70%, these three monoclonal antibodies that we have available to us no longer work. So that in just late December 2021, they said, oh, that threshold has been reached. We're going to stop the program. And I went on Fox News. I went on Newsmax. I went on a bunch of other right-leaning news organizations and said, this is terrible. They're going to kill people. And I actually said that the Biden administration will kill people. And this is a terrible decision. And they don't know what they're doing. And they're misreading the data. I was really angry because we had about 500 people that were scheduled to get infused. And myself and my staff had to call all these people and tell them that they couldn't do it. And I had people begging me, because really this stuff really was the cure. I mean, it really is. It's amazing. It's like nothing I've ever seen in medicine before. And people were saying, oh, I have a family member who's dying and they're so sick. Please, please, please just infuse them. And I said, I'm sorry, I can't. By law, I'm not allowed to do it. And we had literally refrigerators full of this medicine just sitting there gathering dust because we couldn't use it. So anyway, 2 weeks later, the Biden administration came out and said, oh yeah, sorry, we made a mistake. We misread the data. Big shocker there, by a factor of 50%, 50%. So it wasn't 70% prevalence, it was 20% prevalence. And I also said, look, even if it is 70% prevalence, you don't know that that person in front of you has Omicron, and there's no downside to giving a medicine. So why stop it? You're basically, a certain percentage of these people will die or need to be hospitalized because of your stupidity and your terrible decisions. So everything went back to normal. They let us start infusing again. And then 4 months later, out of the blue, I get indicted on federal healthcare fraud charges. I get no phone call. I get no email. I get no letter. I get nothing. They hadn't spoken to my partners. I'm the only doctor in the business, but I have two partners. I had two partners who were the business guys and ran the business side. The government to this day has never spoken to those people. They never looked at any of the charts. They said that we're defrauding the government by upcoding, which has to do with the way charging more than we should have, essentially, with the codes. But they never even looked at the charts before they charged me with a crime, which is just, I don't understand how that makes any sense to anybody. But
the government saying you're overcharging is kind of ironic.
I know.
Because I remember seeing the hearing where they held up a bag of bolts, and I know you're in medicine, but I'm in construction, and they held up a bag of bolts, just a Ziploc bag, and they said, how much does the government charge for this? It was $90,000 for a Ziploc bag of bolts that you could get at Home Depot for $5. So I wrote down a couple of notes while you were talking, right? First of all, the misreading. You said they were off by 50%. Do you think they were misreading, or do you think that they were reading it exactly how they wanted to read it?
Yeah, that's a great question. I will say that to their credit, they did come out 2 weeks later and admit that they made a mistake. So I really don't know. I tend to be a glass half full kind of person. So
Sure.
I don't want to apply any nefarious intent there. But certainly one could read that and one could make a very good argument that there was some nefarious intent there. Absolutely.
Yeah. Now, you said monoclonal antibodies are the best. I'm completely unvaxxed. I refused it. I didn't even wear a mask. I got so much crap for it. I remember on Joe Rogan, he was talking about how he did not just monoclonal antibodies, but he did ivermectin, and there's all these. I mean, you had the same thing, not the same thing, but Peter McCullough was blacklisted. He's the most published author. It turns out he was right about everything, et cetera, et cetera, et cetera. And I also just recently had Dinesh D'Souza on my podcast, and they did something similar to him, where he came out and spoke out against Obama, and then what they do is they go in with a fine-tooth comb and they dig into your life and they find something that they might be able to charge you with. I think that's happened to Trump. That's happened to several people. I think that the Biden DOJ is no different than the DOJ under many administrations, where they weaponize the DOJ, find the man, show me the man, I'll find you the crime, as opposed to the opposite, inverse. So is there any truth to the allegation or any evidence that they have? I know you're not going to admit to a crime, and I'm not saying that you're guilty of one. What I'm saying is, what do they have that they're arguing against for you doing upcoding?
Yeah. They have nothing, zero, no evidence. In fact, so much so that I actually took it to trial. And my lawyer kept telling me, he's like, there's only two types of people that go to federal trials: innocent people and crazy people. And I don't think you're crazy. And so the first day of trial, the first witness that the government calls is this guy that gets up there. And he knew nothing about anything, and the entire case was built around him. And he wasn't even an expert on coding. And my lawyers completely eviscerated him on cross-examination, and not using slimy lawyerly techniques, just the facts, and saying, do you understand these rules? And he had no idea what he was talking about. So much so that the judge actually dismissed the jury, back to the jury room, called us up to the bench, looked at the government, pointed his finger at them, and said, what the hell are you doing? Where's the crime here? Mm-hmm. Your expert witness, about whom this entire case is built, and these are the words he used, was just utterly impeached on the stand and knows nothing about anything. Where is the crime? I'm about ready to toss this entire case right now. Yeah. And the government, oh, judge, it's coming. You'll see, blah, 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 blah. And the judge said, well, you better show me something soon, because there's nothing here. So anyway, fast forward, the government uses whatever techniques, I'll put it nicely, whatever techniques they have to win, and they don't care whether it's truthful or not, and whether it's honest or fair or not. So I was miraculously found guilty by the jury, but thank God, you talked about rogue judges earlier. Thank God my judge actually paid attention, and he issued a 93-page opinion. And just to put things into context, the Supreme Court doesn't issue 93-page opinions. He wrote a 93-page opinion about how silly this case was, about how the government had no evidence. I mean, his direct quotes were, here, I actually wrote them down, so I want to make sure I can get them. Quote, the court, having closely observed the testimony and parsed the evidence in this case, concludes that the evidence weighs so heavily against the verdict that it would be unjust to enter judgment. The government did not carry its burden, and no reasonable jury could have so concluded. I mean, it goes on and on and on in 93 pages about stuff like that. So the judge basically threw the entire case out, and not only acquitted me, but then said, in case the government appeals, you're going to get a new trial. Okay. And again, not just the 93 pages, but the fact that he overturned a jury verdict is like incredibly rare. So thank God this man was paying attention and actually took his job seriously. And unfortunately for me, the Biden DOJ, just before Trump's inauguration, chose to appeal, and they I'm now facing the prospect of a new trial. And Judge Berdar, this very courageous federal judge who issued this 93-page opinion, was supposed to be the judge adjudicating my new trial. Well, about a month and a half ago, we get a one-line email from him saying, I have recused myself from your case. Wow. Which is very curious. Why on earth would he do that? I have no answer. He didn't provide one. So you got to think there's some shenanigans going on behind the scenes.
So, what is the status? I was just pulling up your GoFundMe. By the way, guys, I put this in the show notes, and if we can, help out this doctor. This is the correct one, correct? I just want to make sure I'm not, promoting a scammer.
No. I have a GoFundMe, but then somebody reminded me that of what GoFundMe did to the truckers. So I actually have a
you're right. Okay, so this is the GoFundMe, but I do have the link for the Give Send Go in the description. I'm pulling this off of X, so yeah, just make sure you guys go to the Give Send Go, because that's happened. That even happened to me. I made a GoFundMe for legal defense, based off of, it's completely different. But I was, cancel culture. I was dealing with that this week. I cancel culture comes for me every week, and when it first came for me early on, very early on, when I didn't really even know what cancel culture was, I was like, I reached out to some lawyers. A lawyer came back. He goes, you're going to need a $3,500 deposit. I'll look into this one particular case. It was, I raised the $3,500. GoFundMe took that thing down, refunded everybody their money, didn't give me a reason. It was just because the woke mob would go and mass report it. So glad we brought that up. Do not use the GoFundMe link. Use the Give Send Go link, because I ended up making a Give Send Go after that, raised the $3,500, and voila, they let it actually go. Which is so wild, by the way. I'm sorry, I don't mean to get off track, but you have people like the girl who, called a little kid at the park the N-word and got like $1 million, and then people that are actually trying to raise money for their things. GoFundMe's insane. Anyway,
Yes.
so where is the case now, and what exactly are you looking at? Are you looking at a new judge that's going to be more amenable to side? Because we're now under the Trump DOJ. So have you been saved by that in any way, or I mean, do you think you have? What's going on?
Yes. Well, so I'm looking at a new trial in August.
Okay.
The judge. First of all, I just want to make this clear: the judge that wrote this very courageous judge that wrote this 93-page opinion
Mm-hmm.
was an Obama appointee, and even he looked through and saw the BS that the Biden DOJ was pushing,
Oh, for
which is
sure,
remarkable.
for sure.
So the new judge that I'm facing, I don't know her. It's a woman. I don't know anything about her. I mean, I've Googled her, but I don't really know much about her. Um, I'm trying to make outreaches to the Trump DOJ because, to your point, this all started under Biden. It was
Mm-hmm.
appealed under Biden, and I'm no question about it. This is all lawfare and weaponization. I mean, there's absolutely no question about this. Anybody who looks at this objectively is just mystified that this could even be going on. And I just think that there's some inertia, and the Trump people come in, and there's thousands of cases that the feds are moving forward with, and nobody's really taken the step back and said, "Wow, let me look at this."
Mm.
And that's what I'm hoping to do. I'm hoping to get someone in the Trump world to take a step back and say, "Listen, is this really something we want to be pursuing, and is this really something we want to be spending taxpayer dollars on?" I mean, the whole thing. We can
Yeah.
get into all the details, but the whole thing is so absurd on its face that it's just remarkable that it's even gotten this far. And it ruined my life, by the way, for 3 years, and my wife, and we
I
have
was
4 children.
Yeah, I was going to ask, yeah, how has it affected you? Because that's the goal of most of the DOJ weaponization with lawsuits, is they don't care if they win, they just care if you lose.
Right, and you lose just by being named as. I mean, so I got debanked. I had to stop working for 2 years, and now it was after I was acquitted. It was very hard to get back to work as an emergency room doctor. You can't just take 2 years off because, first of all, the hospitals all look at you if you want to get your privileges back, that there's something wrong with you, that you're tainted goods. And then even if they will accept you back, the insurance companies don't want to insure you because they said, "Oh, well, you haven't practiced medicine for 2 years.
Mm.
So, you're going to be rusty. You might miss something. We don't want to insure you." So it was very hard to get back to work. So I got debanked. I was a member of USAA. My father was in the Air Force, proudly served.
Mm-hmm.
I've been a member since before I was born. I got a letter from USAA, take your money and go. My kids are
What?
still members.
I've heard good things
We don't
about
want your
them.
business.
That's shocking because I've heard
It's a
great
great
things.
organization, but I will never. They said, "I don't want your business anymore."
That's
Truist Bank
insane.
sent me a letter, take your business and go. Multiple online. I had small brokerage accounts. I got letters saying, "Just take your money and leave." I had to return. I have a firearm I've never used. I have a rifle. I had to have somebody else hold that for me, just because I was accused of a crime, not convicted, accused.
How does that
Um,
work in Maryland? Because look, so I was going through, I was assaulted by 3 men. I fought back, but it was in deep blue Massachusetts. They ended up charging me, and it's honestly, ironically, it's because I won the fight. I did. I was not bloody, and they were, and
Good for you.
I got lucky. I'm not bragging. I'm not it's just saying, but
No, but I
I
mean,
just I got lucky.
good
There
for
was
you.
three thugs tried to jump me, and I was quicker. So when the cops showed up, they arrested me just on the sheer notion that no way I could have won this fight unless I started it, which was insane. Anyway, long story short, I was facing felony assault and battery, and then I did get acquitted. I got fully acquitted, but I didn't have to give up any of my guns. Right? I did not even though if I was convicted, then I would have had a felony. I would have had to. But how does it work in Maryland, where if you're accused of a crime, you have to get rid of your gun? I'm not sure. I'm sure it is. But do you know the law?
So yeah, it's not Maryland. It was a part of the judge allowed me to not go to jail before my trial. So part of the pre-sentence release was I had to sign saying if I have a firearm
Okay,
in my
so
house,
yeah.
I'm gonna surrender it. But to your point, okay, so that was part. I had to agree to that. I didn't want to go to jail, and I never used my gun, so I said, fine, I'll let my friend hold it for me while I'm going through this nonsense.
Hmm.
But I lost my TSA pre-check. The worst thing for me was I have, as I said, I have 4 children. I'm very active in my kids' lives. I used to go on to all their schools and chaperone, various things and talk about being a doctor and how wonderful it was. And, during COVID, talking about COVID and everything. I lost my ability to do that because I lost my background check
This sounds
because I was
insane.
accused of a crime.
This sounds
Yes.
insane, right? Because look, and I'm not doubting you at all. I'm not doubting you at all because we've seen what happened to Mary Talley Bowden and Peter McCullough. We've seen what happened to a lot of different people who spoke out against this. But it's like I don't know. I still believe in the justice system. I know that it's broken, very broken. I know that it's weaponized. We saw what they did to Donald Trump, for Christ's sake. I mean, geez, turning one misdemeanor into 92 felonies. It's insane. But what I'm curious about is if there should be some like low, like they had to have something that they could show the judge or show the Justice Department. And this upcoding thing, I'm just wondering what they had. Like, did they have a log? Did they have a like your computer, your hard drive?
Yeah.
What did they have?
Okay. So I didn't want to get it because it's kind of technical, but so there's two through five are there's E&M, evaluation and management coding. There's levels 2 through 5 that you bill whenever you see a provider, be it a doctor, a nurse practitioner, or a PA. Anytime you see somebody for anything, they're going to bill an evaluation and management service. Level 2 being the lowest, level 5 being the highest. And there's a chart, this chart right here, it's hard to see, I know, but this basically tells you, it's put up by the AMA. You can see AMA. It talks about how you choose which code and whatever. Well, COVID was new. Nobody knew anything about COVID, and there was no.
Just to jump in for 1 sec, code would be kind of like barcode, like if you were to shop somewhere, like it tells you how much something costs. Is that? Am I
basically
reading?
yes? So
Okay.
Just to back up a little further, when you see somebody, you go to the doctor, and for anything, the doctor submits a claim to the insurance company, be it private insurer or Medicare, it doesn't matter, any insurance company. That bill that they put forward is your name with a bunch of codes after it. There's no chart that gets put forward. There's nothing. It's just your name and a bunch of codes. Now, it is easy for people to put forth that kind of stuff without actual seeing patients. So that's fraudulent, right? They're putting forth, I saw, Bill Smith on such and such a date, and here are the codes. And they never saw Bill Smith. Now, that's fraud.
Yeah.
And that's typically what they go after people for healthcare fraud. But in my case, there was no question these people were seen. In fact, they called 3 of the 5 counts. The government called these patients, and the patients testified. Yes, I was seen. Yes, I had testing done. Yes, I had my vital signs taken. All the things that we did. And I was the medical director. I wasn't actually seeing these patients. I was just running 8 sites and making sure everybody had the proper PPE, the personal protective equipment. We had all the resources that we needed. I mean, I was a busy guy. I didn't see my family for 2 years during the pandemic. But anyway, so these 2 through 5 codes, I went through that chart that I just held up about 1 million times. And I said, all right, based on my reading of this chart, I think we should be billing what's called a level 4. And I put out multiple emails to the providers explaining what E&M coding was and saying, this is the bread and butter of how we get paid. And the government weaponized that. They took that bread and butter comment, and that's how they proved, quote unquote, criminal intent. They said, look how greedy this guy is. He keeps talking about bread and butter, bread and butter. I mean, honestly, that's what their evidence was. This is the bread and butter. And I would say that every time, every hour of the day, it is our bread and butter. 90+% of how we get paid as doctors is through E&M coding.
Yeah,
so
but
how is that in any way nefarious?
Wasn't the government also giving out bonuses to doctors that were pushing vaccines and you weren't doing that? Right? So like they're telling you, they're saying it simultaneously, right? They're saying, okay, we're going to incentivize doctors to code for vaccine. I think that's how it would be, like push vaccines, charge vaccines, big pharma gets rich, yay, we're all happy. But at the same time, they're also coming after people who don't go with the official narrative and saying you're being greedy, you're charging. Because I think it was Mary Talley Bowden, we don't agree on everything, but I do support the fact that she was, sticking to her guns on certain things, where she was saying that she could have been a millionaire in her small practice if she just, did
Vaccinated
that.
everybody.
Yeah.
Yep. Yes, absolutely. So that's one thing that they did. And then they said, oh, well, you're not spending enough time. So the indictment, if you read, it's public. You can go find my indictment, and it says that we weren't spending enough time with the patients. Well, their quote unquote expert, the guy that I told you about that got so thoroughly impeached on the witness stand, he testified, and he's not an expert, but he testified that time is not a factor. Doesn't matter.
Sure.
So he testified 100% opposite of what the indictment said. Then they said, oh, well, none of these visits were medically necessary. Again, the same guy testified that, yes, of course they were medically necessary. And we called a doctor who said, of course they were medically necessary. You can't be ordering all these tests without having them see somebody. So their own expert, quote unquote, went diametrically opposed to what they said in the indictment. Now, I will tell you, they charged me with 5 counts of healthcare fraud. That's 5 patients. They never had a professional coder look at any of those 5 charts. They had government lawyers look at those 5 charts. And the only time they got those 5 charts, as I said before, was after they indicted me. And there's no way for them to know whether there was upcoding or not until they looked into the chart.
So I think what I mean, this is just a guess. I don't have any evidence of this, but I think what they probably said was everybody does this type of fraud, so let's just arrest him, and I'm sure he has it, and then you didn't. That's probably where their mind was going.
I'm sure. And I'll tell you that, of course, there were red flags, right? So red flag number 1 was the year before the pandemic, my company, I think we billed like $800,000. The year of the pandemic, when it started, that year we probably billed, close to 20 million. But that's because we saw over 100,000 patients.
Yeah,
and
well, it was.
We went from
yeah.
And we went from 6 employees to almost 300, and we went from 1 site to 8 sites. So and our overhead was 95%, 90%, something like that. So it wasn't like we were stacking Benjamins in the backyard. I mean, we were spending money as it was coming in the door.
Sure. So you expanded your practice around the time that this all happened, and that they took that as the red flag.
And then and the other red flag is, those codes I was talking about. You're supposed to have, a nice bell-shaped curve of those codes, with code 3 being the majority, 4 being less, and 2 being less, and then 5 being like very low. Well, all of our codes were 4, but there's a very good reason for that. But the government never gave me the opportunity to discuss that and say, they could have called me and said, hey, why are all your codes being level 4? Well, because every single patient that we're seeing, over 100,000 of them has COVID or has been exposed to COVID.
Yeah.
And they only looked at 5 charts total. And again, not even a professional coder. We saw over 100,000. They extrapolated those 5.
Out of 100,000, they found 5.
They looked at 5, right? We had a professional coder look at hundreds of them and said.
And I wonder,
the guy wasn't.
Did they cherry pick those? Did they cherry pick those? How did they get those 5?
I have no idea how they got those 5. That's a great question. I don't know.
Because over 100,000, I mean, you'd probably be able to find 5 cases that might be accidental. That would just be normal.
Exactly right. There's a mistake in the charts. I mean, and the providers, they called some of the providers and they testified, yeah, sure, I made a mistake in that chart because I pulled up, we had templates.
Yeah, human error. I assume that happens. I mean, look, my doctor, I'm on TRT, and I've been on Adderall since I was a kid because I don't know if you noticed, but my attention is. My attention is not the best. So, but here's what they do with me, right? They charge. I don't even do insurance. It's actually cheaper for me not to do insurance. I use GoodRx, and I do the in-house with my primary care. I think I pay them $100 and something a month. And what they do is they charge me for the visit. I think it's $100 something. They do a televisit. The woman gets on the phone. My doctor, lovely, but literally we FaceTime and she goes, how's everything? And I go, great. And she goes, any changes? And I go, no. And she goes, okay, click. And that's it. That was $100. And I'm fine with that. I get it. There's regulation. They have to see you. They have to put eyes on you. They have to ask you 2 questions because that's just the way it is. No problem with that at all. But I'm assuming if she were to bill the insurance company and say, I saw, Zach and did this, and we didn't do that FaceTime, then she'd be guilty of fraud. But just because she just did that quick little FaceTime, she's following the rules. So I'm assuming that there would be somebody in that office who was booked for a FaceTime, and then the the clerk or the nurse or whatever at the front desk charged the insurance company, even though they didn't have the FaceTime, et cetera, et cetera. And then some, auditor could come in and find that. But that's not fraud. That could just be a mistake, a human error. And you're saying out of 100,000 patients, they found 5 that didn't even have an error in them.
Well, I look. I'm sure there were errors in the chart. One of them there was one of the providers testified that we had templates, and she pulled up the wrong template.
Okay,
but that was her mistake. I didn't tell her to do that.
Yeah,
In fact,
exactly.
I told her to
Human
do the
error. Yeah,
opposite.
that's human error, not
But
fraud.
and there was no evidence that I was telling people to do any. I did tell them that I thought level 4 was the appropriate billing, but I didn't hold a gun to anybody's head and say you're going to get fired unless you bill it this way. In
Sure.
fact, we had multiple of the providers testify that they were free to choose whatever they wanted to do. So, there was no evidence that I did anything wrong. It was just remarkable. And again, I just want to go back to just the unfairness of this all. Like, had they just picked up the phone, and what they're supposed to do, by the way, according to their own rule book, is they're supposed to, if there's a question, contact the provider, contact the office, ask for charts, and do an audit, which they never did. And say, send us, 50 charts, and we're going to go through them. Send us 100 charts, and we're going to go through them, whatever. And they never did that.
Now, I want to pull this up. I just saw this here. It's I think that you just had this this on January 31st. This
yes, with
thing.
Dr. Margaret. Yeah.
It says you face but it says you face up to 50 years in prison. Is that true?
It is.
How would they get you at 50 years for upcoding if they were able to prove, which I don't think they will be, but what are the fraud charges and sentencing guidelines for those charges? Like what are you being charged with exactly, and what are the penalties?
Healthcare fraud, and each count carries up to 10 years in prison and
so $5
millions in restitution.
So you have five charges of healthcare fraud, and each one of them could be a maximum sentence of 10 years?
Correct. Now,
Okay.
there's no way, according to the federal sentencing guidelines, that I would have gotten 50 years. I mean, look, it's possible. The judge could say,
No, yeah.
I think you're a piece of crap. I'm going to throw 50 years at you. I have no criminal record. I've never done anything wrong.
Sure.
So I doubt that would happen. So
But no, you still are facing
10 years.
Yeah, you still are facing
more likely
up
8 to 10 years. And, I for what? And again, even if you want to say, okay, so the government argued that we were somehow wrong at a level 4, but they never said what the right level was. And they never said why I was wrong to bill a level 4. So even if you want to say, fine, let's settle on a level 3. Number one, I would have happily gotten on the phone with the government or met with them and said, okay, let's refund some money. It's a disagreement. No problem, whatever. They never did that. Number two, you're looking at, the difference between a level 4 and a level 3, depending on the insurance company, is probably somewhere in the neighborhood of $30.
Mm-hmm.
So 30 times 5 is $150. You're talking about throwing me in jail for 50 years because of $150?
Yeah. And I mean, look, I don't think this is a coincidence either, right? This is an article from Fox News. Maryland doctor says people are going to die after Biden administration uses faulty data to snub antibody treatments. I think
that's the one that got me in trouble.
Yes. I think that had you not said this, I don't think we'd be having this conversation. Now, I can't prove that. Right, and I don't like to do conspiracy theories. This isn't the Candace Owens show, but I do believe that their coincidences are very rare, and it's no surprise to me that Peter McCullough, again, one of I think the most published expert in this field, was completely smeared, tarred and feathered. You had a few other doctors, and you have Mary Talley Bowden, and you have what looks like a weaponization of the former administration's Department of Justice against doctors who did not get in line. And I don't know how you felt about masks. I don't know if you said anything about masks, but I was banned off of TikTok for saying all I said was, I go, look, here on the side of the box of a mask, it says this shit doesn't work. In a sterile environment, in like the standards, I can't remember what they call them, but like the OSHA of the medical industry, it says that you have to remove that mask, that sterile mask, every 20 minutes in an operating room and replace it with a new one. And you guys are walking around with some fucking rag that you put in your cup holder and you're slapping it against your face. I go, I'm not wearing one. I lost a job that I was doing. I got kicked out of the bar across the street because the guy who owns it is a fucking liberal. I went through the minor, uncomfortabilities of standing my ground. You're going through the major uncomfortability of standing your ground. And I don't think it's a coincidence. I think you were targeted based off of this conversation and the limited amount of research I've done. Now, it could come out that you're lying, and we look it up, and we find out that, hey, we were all duped. That guy actually was committing fraud. But I'm leaning towards no, because
Well, I thank you, and I appreciate that. And I can tell you, it's not just me. The federal judge, an Obama appointee, issued a 93-page opinion overturning a jury verdict, which never, ever, ever happens. And he
and
agreed.
the jury, by the way, sorry to cut you off. The jury,
No.
and what's the voting record like in the district that you're in?
Oh, it's very liberal. I mean,
Very
it's
blue.
Maryland,
So
right?
you're
It's a blue
no,
state,
and I already
know.
knew the answer to that question, but
Yeah, I'm sure you did.
jury, look here's the thing. First of all, you can indict a ham sandwich, and you can also you can get a jury. You can get a venue in a very heavily favored political environment. Look, when the story that I was telling you about the guy who apparently I beat up, right? I beat up this old man. They said he was 60 something, but he didn't look it. I think the reason the jury sided with me was because the guy who apparently I assaulted had a AR-15 weapons charge where he assaulted his landlord and had an AR-15 on the table, so he didn't have it improper use, improper storage, improper firearm for deep blue Massachusetts where I was. One of the jury members was straight up a trans person. I was like, I am screwed if they find my social media. Like if we don't wrap this up today, right? Like I told my lawyer, I go, if we don't wrap this up today, if this goes into tomorrow, those jury members are going to go home, they're going to go on social media, they're going to type my name in, and tomorrow I'm guilty, right? And it would have happened, but luckily we wrapped it up in a day and we didn't have to go through that. But again, just to be very clear, justice is not blind when it's put into politics.
Oh, and I'll go one further, Zach. I ran for state senate as a Republican in this very blue state. I almost beat a 30-year incumbent, and I to this day I believe hold the record for fundraising.
I don't think that helped you either.
For a Republican challenger. No. But my partner that I mentioned before, that the government never even spoke to, who basically ran all the business side, he was a sitting Republican delegate in the Maryland State House. And during all of this, they tied him to me, and he ended up losing his seat over that.
Out of here.
So you really can't get away from the politics here.
Hold on. We gotta hold on. Your business partner was a delegate who lost his seat due to this.
Well, I can't say it was due to this, but they tied him to me, and they made a big PR campaign about it, saying, "Look, his business partner's guilty of fraud, even though I wasn't guilty." And all this other stuff.
I'm pretty sure that this was weaponized against you. I'm that new information has set me over the edge, because because it would be one thing if you were not on, your political affiliations online weren't available, but you said that you ran against a Democrat. Your business partner was a current delegate. They took one look at you and they went, yeah, fucking him. Get that motherfucker. I guarantee it. It's because we have a pattern here. We have enough circumstantial evidence of a weaponized justice system to not go down the Candace Owens, fucking B cult killed Charlie Kirk. But what I call myself is, I call myself a conspiracy realist as opposed to a conspiracy theorist, right? It's more than plausible that this is what happened to you, as opposed to just some wild, like, oh, there's enough circumstantial evidence here.
Yeah, and I use this phrase all the time. My wife hates it, but I don't know a better one. I feel like when I'm telling my story, I'm wearing a tin hat and I'm talking about aliens coming down from outer space and like whatever, building the pyramids in Gaza.
Yeah.
I mean in Giza,
Yeah.
because it's like Giza, not Gaza.
Yeah, well, they could build a casino shaped like a pyramid in Gaza now. I mean,
Yeah, but this is real, and fact is stranger than fiction. I'll give you one extra one. So I got invited to the Department of Justice last week or 2 weeks ago, excuse me, as a guest to speak about weaponization of the DOJ. The very same DOJ that's charging me with the crime and trying to throw me in jail invited me to be a guest as a speaker at a roundtable discussion about weaponization at the Department of Justice. I got there, I had a special badge with my name on it. I had to have a background check to get in there, all this stuff. And it's on my social media. I posted pictures of me at the Department of Justice giving a lecture, talking about my case to the very same people who were trying to throw me in jail. I mean, you cannot make this stuff up.
it's wild, man. I mean, well, look, here's the thing. We are under a new DOJ, but the old DOJ, it wasn't the top down. I mean, first of all, I'm not a huge fan of Bondi either. I mean, I'm not saying that she's bad or corrupt or anything. Somebody in the chat was already saying, don't trust Blondie. She was a litigator for Big Pharma. I don't think that this DOJ would be nefarious or weaponized in the way of the last one. Let's just put it that way. However, the judges are still there, right? The judges are still there. The swamp is still there. There's still corrupt actors in the Department of Justice. You don't now a year, about a year, maybe a little less because when Pam Bondi was, I think it was March or something. No, you're not going to get rid of the rot in there in a year, 2 years, or even 3 years. You're probably not going to get rid of it ever, but you can definitely chip away at it. I've seen, the judges who are jumping in, intervening on all of Trump's executive orders, and I'm like, that's not your fucking job. You're a district judge. You're a federal judge in a completely different district, and you're trying to dictate,
Right.
Governmental policy, et cetera, et cetera. So my point is, there are clearly activist judges in the Department of Justice, and I think they should be prosecuted. I think they should be investigated. I think they're the ones who should be investigated and prosecuted, not you, for speaking out against whatever mandates, and then have them go in with a fine-tooth comb and maybe find a couple of errors and maybe find some irregularities. You went from 800,000 to like a couple of million because, you expanded your business, what have you, et cetera, et cetera. But it's really concerning that we can change the Department of Justice from the top down, but the lower level is where the rot is. It's literally the judges. And we got to do something.
And the prosecutors.
Yes, the prosecutors as well. I mean, activist prosecutors are fucking insane.
I'll go even another step further, Zach. So as I told you, I was very adamant about the monoclonal antibodies, and I was very active. The federal government reached out to me. The Department of Health and Human Services called me and said, "Hey, you're really good at these monoclonal antibodies. We want to set up a site at FedEx Field in Landover, Maryland, where the Washington, at that time, the Redskins play football.
Mm-hmm.
You set it up and run it for us in partnership with us, with HHS and the Maryland Department of Health." So basically the feds came in, called me and asked me to set up and run this site and say, we're going to pay for everything. You run it. And they did that. And we set it up. And talk about DEI. This was in an area of underserved people and a predominantly African-American community. And the reason they were putting it there was because of DEI. And it was successful. It worked well. And I'm glad we did it. But would you go into business with someone you think is committing fraud?
No.
And the government reached out to me. And by the way, for my work during COVID, I got a personal citation from our former governor, Larry Hogan. I got a personal citation from the Maryland State Legislature. And even after I got indicted, the State Medical Society named me their Person of the Year for all the work I did during COVID. I don't say that to pat myself on the back.
No.
I say that because, I was out there saving people's lives and doing stuff. And again, if you want to talk about money, because that's really what this is about, the amount of money that what I did saved the system, you're talking in the hundreds of millions of dollars. Forget about the number of lives we saved. That's got to be in the thousands. But then you're talking about the amount of money we saved is in the hundreds of millions of dollars, and they're coming after me for $150 basically.
Well, again, yeah, if anybody's argument was that you were, trying to help big pharma, then that you'd probably under last administration, you'd probably get an award, right? But you were trying to help, patients. That's the thing. It's like there are so many doctors that just took the money. They literally just took the money. Like they go, all right, we're seeing that there's a high risk of, heart attack. We're seeing that the spike proteins, this, and this. And then you have, like I said, ivermectin, a Nobel Prize winning drug with a very low side effect rate, which is an option. It's not necessarily a cure. It's an option. You have monoclonal antibodies. From what I understand, very low risk. That's an option.
Exactly.
But
yeah.
what they pushed was the option of, okay, this is completely rushed, and Operation Warp Speed. Some people praise it, some people don't. I don't. You literally just said, okay, this is fucking new. It could be fine, but it could also not be fine, as opposed to these tried and tested options. And the doctors who literally just said, okay, we're going to put an experimental drug that we know has a spike protein in it that could be causing heart attacks and cancer in young people into people's bodies because we're getting a bonus every time we do it. Fuck those people. I mean, I think those doctors should be buried underneath the prison. I think they were murderers. I think they were mass murderers. I think they're the same as the people who pushed oxycodone and opiates during that epidemic. I cannot tell you how little respect I have for doctors who are just all in it for the money. You don't appear to be one of them. And I appreciate that, which is why we got your Give, Send, Go. Let me go with my profile. Instead of the GoFundMe, I just put this up. So I wanted to go here. This is the Give, Send, Go. So we know that this is, and we need to get this number up. $100? Come on. I wanted to read this from you because these are in your words. All right. So, let's see here. For 4 months after speaking out, I was indicted on healthcare. We've already covered pretty much most of this. Biden DOJ. Legal fees. All right, here we go. The legal fees are still mounting quickly. The loss of income has made it harder to keep up. I'm reaching out for help because I cannot do this alone. Thank you in advance. How much has this costed you so far?
Let's just say multiples of millions of dollars, of which I didn't have. I mean, look, the government makes it seem like I'm Tony Soprano when I have money hiding in my, my air vents, and my air conditioner out in my backyard. I look, during COVID, we saw lots of people. I made money. I'm not ashamed of that. I didn't make an inordinate sum of money, but that's been all gone. And as I said, it didn't work for 2 years. My wife, thankfully, has a job. She's a pediatric oncologist. She treats children with cancer at Johns Hopkins, and she runs their bone marrow transplant program. So thank God she still had a job and she was able to support myself and our 4 kids. But the legal bills were multiples of millions of dollars, and now I face a new trial, which is going to be even more than that.
Jesus. And you don't get that money back. Like a lot of people don't realize. A lot of people don't realize you don't get that money back when you're the defendant. You don't get that money back. You're giving that to the lawyers. That those lawyers are going to do their job and make their money, and they deserve it because they're going to keep you out of prison. But when the DOJ or when anybody weaponizes anything against you, like for instance, right? Like I said, I'm not comparing these two situations, but the case where I was jumped, I did nothing wrong. I used self-defense. That's what the jury found out, and that's why they acquitted me. I used self-defense. It cost me thousands of dollars. I didn't get that money back. Right, thousands of dollars to defend myself for something I did not do. Right, I had to pay my lawyer $5,000 to get me off for something I never did, and it seems like nothing, but $5,000 is $5,000. That's a lot of fucking money to me. And you're in the millions, and you're not getting that money back, and it's fucking tragic. And I'm
not getting my reputation back. I'm not getting
correct. That's the other thing. Oh God, my reputation.
That I didn't get to see my kids. I was scared of my shadow for 2.5 years. I was just to get out of bed was like a chore. Like I did it because I have 4 kids and I wanted to put up a good face for my children. But I mean, if I wasn't the person that I am, I would have been a raging alcoholic by now, or a drug user or something, because they know that, and that's their goal. As you said before, like, there's two ways the system works. They either get you to plead guilty to something or they throw you in jail. That's the way the system is designed. It's not designed for somebody like me who gets off, because they don't like that. That's not how it's supposed to work for them.
Yeah, and this shows about you, but I do want to give you a comparison, right? Because you said reputation. This is these are my bookmarks. Okay, I want you to take a look at this. This is the screenshot that everybody shares. This is a mugshot. That mugshot isn't even from that incident. That's a stupid DUI that I also beat from years before. But it says assault and battery. So they just look it, right? These are my, and they also Grok called me a pedophile too, by the way. But they put this is, look it, see another one right here. There it is again. They throw this at me, I would say daily, right? There it is again. And I am acquitted. I am fully acquitted. But this will pop up every single day under my social media. So when you said you don't get your reputation back, you're right. Right? And they will weaponize this against you for as long as you're on the internet. Even if you were to win this case, get yourself fully acquitted, even if you were to sue the Department of Justice for the weaponization of government, get a settlement and get all of your money back, it doesn't matter, because some asshole will still go, you were charged with fraud, you're a fraudster, you're a shit doctor, exactly. It doesn't matter. The truth doesn't matter.
Yeah, no, and I mean, like I said, I didn't sleep for 2.5 years. Literally, I didn't sleep. My kids, all of them are very well adjusted. At the time, my youngest was 3, so he didn't really know what was going on. But the rest of the other 3, the older 3, all had to go into therapy. My 12-year-old at the time, she wouldn't leave my bed for an entire year. She slept by me because she could not get out of my bed because she was so scared. And I would sit there and stare at the ceiling, and all night long, and she would sleep next to me, between my wife and I, and just sit there. And I was just, people ask what this experience was like. I would say it's just below, on the badness scale, just below losing a family member.
Yeah,
that's what this is like.
I like I said, this isn't about me. This is about you. I just can empathize with you because I've been part of the online smear thing. Luckily the Department of Justice has never been weaponized against me. Not really. Although my stalkers, the people online, they did actually call the prosecutor or email the prosecutor during that trial and tried to submit crazy evidence that were like lies and smears about me. And he was actually trying to submit it into the judge. And my lawyer was like, here's the deal. We can't put you on the stand because he's going to ask you about it. He's going to ask you, did you say this online? And I was going to go up and I was going to take the stand, but I ended up not doing it. But yeah, I mean, I appreciate you coming on. I want to put this up on the screen one more time because I think that we need to, the only way to fight this is to fight it together and take care of each other. So guys, if you can go ahead and head over to the Give, Send, Go that I either just put on X or it's also in the description, and help out Dr. Ron here. I think that we've established pretty much that this is what we think it is. And I'm fair. I'm fair. I always say, this guy could be lying. He could be an actual fraudster. I'm not convinced you are.
Well, thank you. I appreciate that. But I'll tell you, I did take the stand in my own defense, which, as you said, most defendants don't do, but I did. And you asked before, like what can be done, or what am I? I was quiet for 2.5 years, and I let the process play out. And my lawyers told me not to say anything. Well, I realized that didn't get me anywhere, so I decided to start going public. And first of all, again, thank you for having me on your show. I really appreciate this opportunity, and it's great to talk to you. But I will tell you, like, doing this, you never know where this kind of thing will go. And I will give an example. I was on, you mentioned her before, Mary Talley Bowden's show, right before Christmas, and I get a phone call out of the blue. My phone rings. I don't recognize the number. I answer it, and the person on the other line says, "Hey, Doc, this is United States Senator so-and-so. I just saw your interview with Mary Talley Bowden, and I really want to help you." And, so we spent 20 to 25 minutes on the phone. He gave me his cell phone number. He gave me his personal email account. And then he said, come into my office in DC. I live in Maryland. I'm about 45 minutes away. So I made an appointment. The next week, I was in his office for an hour with him and 3 of his legal staffers. And he was taking notes, and he asked for follow-up information and all this other stuff. So you just never know where this is going to go or who's listening.
Yeah. No, I mean,
You
and
know?
look, this is a small podcast, but for some reason, the clips of this they go viral, and I get thousands of people that watch on X. But I always get those people that are like, like, oh, you only have like 300 viewers in here. Yeah, right now, but we will clip this. We'll kick it up the chain. There are plenty of people in the administration that follow me. I'm connected with the good people. And hopefully somebody does see this, and hopefully somebody does, jump in and help you out. And we'll do whatever we can to get this to the right people. But
Thank you.
it pisses me off because it really is like the culture. And I think it's a lot of it's like cancel culture, but I'm talking about the culture of the truth doesn't matter. And that's what that's what my shirt says. Fuck cancel culture.
Yeah.
Right? And in red here, culture, the word cult is in red because we have become a cult, or not we, sorry. Society has gone into these little mini cults of, this guy is on a different team than me, let's destroy him, right? Let's destroy his life. And it really is one side, right? We on the right, I don't think that we criticize, we fight back, but I don't think we try to destroy people based on lies. I don't see that from our side. And
we don't wish ill upon people.
no, because most of us are Christians, and it's just against it's against our belief system. And I think we need to get a little tougher, but we don't. I think that Trump does a really good job of walking up to the line and maybe tapping his toe on it, but I don't think he crosses it. Like he could have locked up Hillary. He could lock up Biden right now. He could lock up a lot of people. He could do what they did. And he's not doing it. And there are actually people on our side who are mad that he's not weaponizing the justice system. And I'm like, that's good. I don't
Right.
want to see Trump going in and kicking people's doors down and fucking up trials and making us the bad guy. But I do want to see it happen. I want to see these judges investigated. I don't want to see them locked up without evidence or without due process. But when you see a judge that acts as an activist, like you said your first judge was not like that, but let's say there was a judge that was doing that, I think that's it's not show me the man, I'll find you the crime. It's the behavior that judge is exhibiting makes it look like he's got an agenda. Let's go and find out if he has one. And then if you find that, I want that guy perp walked. Right? Like, that's what I'm saying. So I think that's the only way to fix the issue, because they feel so emboldened because of the power that they have. And I think that's why they get away with doing things like they're doing to you and others.
And there's no accountability. So
That's what
you're
I'm
right,
saying.
They have this involvement. Absolutely. I mean, it doesn't matter. They get their paycheck whether they win, lose, draw. It doesn't matter. And they just want the scalp. It's
Yeah.
all about the win for them. It's all about and they don't care whether justice is served or not. And
Yeah,
be
they
it
don't
the
care if
judge,
they
be it
ruin
the
your life.
prosecutor.
They don't care if
Correct.
they ruin your life.
They don't
Your
care.
life does not matter to them. Yeah.
No.
Well, it matters to me.
And that's a great point. Well, thank you. And that's a great point. And I think it needs to be said that I'm not the only person out there that this kind of thing is happening to. It's lots and lots and lots of people. There's a great organization. You mentioned Cynthia Hughes. She runs the Weaponization Watch, and she runs the Patriot Freedom Project. Wonderful woman. She does a great job. She's fantastic. Doug Mackey helps with that. These are people who are good patriots that are really trying to help people who had the system weaponized against them. Thank God you had me on your show, but like, not everybody has the opportunity to come on your show that this has happened to. So there's lots of people, and this could be anybody. They can do this to anybody. They can do it to the President of the United States.
Yeah.
They can do it to anybody.
Exactly. Well, this is a great conversation. Dr. Ron, thank you so much for coming on. And let's go and find your social media, because I did not put that in there, but I did just follow you. Let's see here.
It's at Ron Elfenbein, MD.
At Ron, let's go here. At
Ron, ELF.
there it is. Yeah.
There you go.
Okay, guys. So head over to this account, and you got Dr. Ron. I'll tag you in any clips that I can put together. I am extremely busy. I still haven't clipped. I told Dinesh D'Souza this. I said, you know, Tom Cruise could have asked to be on the podcast at the same time you did, and I would have picked you. I've been a fan of his for so many years, and I was basically like, that was like my big one, my big, you know, like this is my guy. I haven't had time to clip that frickin' show, and it was 3 weeks ago because I'm knocking down walls and building bathrooms and all sorts of shit. But I will try to get a couple of clips out. And hunting season's over now, so my weekends have freed up. So
protect those knees with the drywall.
Yeah. You know, my back and my knees. You know, I just started. Hey, you know what? You're a doctor. Maybe I'm not sure if you know about this, but I just got on peptides, NAD plus and BP 157, TB 500. Yeah. I've heard those are good, but my back and my knees. I went to a doctor one time. You'll find this funny. I think you'll laugh at this. I went to a doctor one time. I had my MRI. I have 2 herniated discs, a bulging disc, Osgood Schlatters in my knee. I have something going on with my damn, you know, thumb joint here. I'm just a mess, right? And so we do an MRI on my back, and we go over all of my medical history, this, that, and the other. And the doctor's like, "You're a mess." He's like, "What do you do for a living?" I go, "Oh, I build kitchens and bathrooms." He goes, "Oh, you know, you need to find a new career. That's what's doing it." So I told the doctor, I go, "Hey doc," I go, "let's say this was your MRI, and I walked up to you and I said, you know, doc, you need to stop being a doctor because your back hurts. What would you do?" Right? And he was like, "All right, I see your point." And I go, "There you go." So, anyway, thank you so much, Doctor. We'll have you back on for an update. Hopefully, your case in August goes well. We'll see what we can do to get the word out for it. Hopefully, yeah. Hopefully, they just, you know, hopefully somebody steps in and goes, "Hey, what the fuck?" But we'll see.
Yeah.
Anyway, thank you so much for coming on.
Thanks so much for having me. Have a great day.
You too. All right, boys and girls. That was Dr. Ron. Oh shit! Hold on. Elfenbein. That's what it was. Elfenbein. Got it. Dr. Ron Elfenbein. That was a great conversation. Head on over to his social media and his Give, Send, Go and help out if you can. And we'll do a follow-up. We'll do a follow-up after August. Hopefully it goes well. So at the end of every show, as you know, we do the shout-outs only for Rumble chat people, chatters, and not a lot of people in here on the Rumble chat, but I know that X is blowing up. So TPH14, Celestial Heart, On the Edge, Meg B1234, and 7 Legion Studios. Oh, and Eden. Thank you guys for coming in, and we will see you. Wait, what's today? Tuesday. So we won't see you tonight. Hopefully we'll see you tomorrow. You know, work is crazy, but I think I'll be here tomorrow.